Hello, healthy women. Today, let's talk about uterine fibroids. What are uterine fibroids? Uterine fibroids are tumors that grows in the muscles of the uterus. The uterus is the womb of the woman where we get the menstruation comes from, and also where pregnancy occurs. So that is the wall of that womb is where fibroids grow from, and so they are called uterine fibroids. They are benign tumors that hardly leads to cancer. We have about 20 to 80% of women who will have uterine fibroids in their lifetime before the age of 50. What are the causes of uterine fibroids? Nobody really knows the cause of uterine fibroids. So like we say, they are benign, and there may be risk factors. Some of the risk factors we know is genetics. If any of your parents, your mom, your sisters, or aunt has uterine fibroids, a woman may likely have it. If you are from African American descent, that's ethnicity come into play, one can have it. Age, women with between 20 to 50 years of age. So they are mostly commonly seen from 40 years of age. And then obesity and your eating habits as well. So eating habits that involves red meat, a lot of meat, may predispose to uterine fibroids. Don't forget, if a woman BMI is too high, that means obesity, then she's 2 or 3 times more likely to have uterine fibroids. So let's look at the incidence of uterine fibroid leading to cancer. It's very rare, rarely causes leiomyosarcoma. So we can say 1 in 1,000 can transform into a cancerous lesion. So like I said, very rare to cause cancer. So now let's look at the symptoms that can occur with uterine fibroid. The most common symptom, of course, is bleeding, heavy menstrual bleeding. So when a woman notices that during menstruation she uses more pads than usual, or the periods become longer. The normal period length is between 2 and 7 days. So if the period becomes longer than 7 days and becomes heavier, those are the symptoms that you can get for uterine fibroids. Sometimes you can have pressure effect in the pelvis. When a woman starts feeling very heavy, frequent urination, something compressing the rectum at the back, or backache. I've had patients that complain of severe backache due to fibroids maybe impacting into the sacral area. So there could be pain during sexual intercourse, there could be intermenstrual bleeding in between periods, there could also be postcoital bleeding if a woman has the type that comes out through the vagina. We call it a polypoid fibroid. Symptoms that could also occur in pregnancy. If a woman has fibroids coexisting with pregnancy, during the second half of pregnancy, she can start having low abdominal pains, and those pains are usually more serious than regular pains during pregnancy, and so she may need some treatment for that. During pregnancy, the fibroids undergo what we call red degeneration, and that could be responsible for the pain the woman has. If the fibroids is located at a lower region where the baby is supposed to engage, where the head of the baby is supposed to engage, and the baby cannot engage, then it means the woman will be predisposed to having cesarean section, and of course abnormal lie of the baby. The baby will not be able to lie properly, and so it can be breech or transverse lie because there's a fibroid. So this could lead to increased incidence of cesarean section in a patient with uterine fibroid. Outside pregnancy, how do we investigate? How do I know I have uterine fibroid? The best investigation is to do a uterine sound, an ultrasound. An ultrasound will show the locations of the fibroids, and we have different locations. The fibroids are located in the muscle layer of the uterus. So some can be tilting towards the inside, where we call the submucous fibroid, or it can stay in the middle of the muscle layer, and we say it is myometrial. And then those that are tending towards the peritoneum, outside the uterine cavity, we say they are subserous. So those are the different locations of the uterine fibroid. The ones that are mostly causing heavy menstrual bleeding are the submucous fibroid. So depending on how large the size of the fibroid, those are the it will lead to severity of symptoms. Sometimes you see a woman that looks like she's pregnant and she's not pregnant. All she has is fibroid occupying the uterus, and the fibroids grow as if the woman is pregnant. And so when you see a woman that is having a very big tummy, she needs to really check it out. And apart from uterine ultrasound, there could also be MRI to diagnose the fibroids. You could also do a CT scan depending on if the fibroid becomes solidified, because the fibroids can undergo changes. Now that we have a lot of patients taking herbal treatment, you know, we have a lot of myth about uterine fibroid. A lot of women don't want to come to the hospital for treatment, so they seek herbal treatment, and then you notice that a lot of the fibroids undergo degeneration. We have different types of degeneration, hyaline degeneration, yellow degeneration, and during surgery we notice that some of those fibroids become very soft and they lose their cleavage plane. So we have to be careful about the types of herbs that we use for fibroids. Some women insert herbs into the vagina and it occludes the vagina after burning the vaginal mucosa. And of course, whoever gave them the herbs would have told them that once there's water coming out, is the fibroid that is melting away. This fibroid doesn't melt away. It only softens and won't come out until we seek medical help. So there could be medical treatment or surgical treatment. If you want medical treatment, then sometimes for the heavy menses, there are hormonal drugs that can be used to help in the treatment. We have drugs like Depo-Provera, Mirena, where we put in an intrauterine device that has some progesterone that can help in reducing bleeding. But all these are temporary treatments when you use medical treatment. If you want a more definitive treatment, you go in for surgical treatment. Surgical treatment can be in form of just removing the fibroids from the wall of the womb. We call it mammectomy. Or if you have completed your childbirth, then you can remove the whole of the uterus in the form of hysterectomy. So don't be afraid of, treatment for fibroids. If you still want to have children, you can just remove the fibroids. And if you have completed your childbirth, then you remove the uterus. So please, let's be careful and take care of our health. Don't be afraid of uterine fibroids. The treatments are so easy. You don't need to be scared and run away from treatment. Once it's treated, we even have newer treatment methods. Have you heard about the high frequency ultrasound that can be used to treat very small fibroids? And of course, after treatment, you won't even see any scar or any side effect. So I want my healthy women to be conscious of their health. Know when you have masses in your tummy. You should look at your tummy regularly, press it and check, do you have any mass? Can you feel any mass? Is my tummy soft? So let's be conscious, let's be health conscious, and take good care of our body. So see you next time. Share this video and subscribe to my YouTube channel. Thank you. Bye.